Sylvia, I think you're muted.
Sorry. Buenos días a todos y a todas. Es un gusto para nosotros, desde la OPS, seguir con
Here
essa
for us to begin with this session as we celebrate International Nurses Day regarding the need to invest in nursing as we address this current pandemic. We have a very interesting agenda over the next 2 hours.
Sessões de interesse de todos.
We will have many sessions of interest for everyone, and it is a pleasure as we introduce Dr. James Fitzgerald. Dr. Fitzgerald is director of the Office of Systems and Services from the of Health Systems and Services for the Pan American Health Organization. Dr. James, you have the floor.
A very good morning to you all, and welcome, a very warm welcome to this International Nurses Day, where we're celebrating really the commitment and dedication and the enormous efforts that have been made over the last year by all our nursing professionals in addressing not just the COVID-19 pandemic, excuse me, not just the COVID-19 pandemic, but also ensuring the provision of much needed essential health services throughout a health system that has really been compromised in so many respects within the context of the pandemic. The theme this year is on the need to invest in nursing, and we're looking at lessons learned from the pandemic. What we've seen from a macro analysis of the region is that we not only have witnessed an enormous impact in terms of lives and livelihoods as a result of the pandemic, but the indirect impact as a result of disruptions in the provision of essential health services, resulting in reductions in immunizations, reductions in antenatal care, in consultations for NCDs, in communicable diseases with treatment levels for HIV reducing. We're seeing across the board impact that will take us much time in recuperating lost public health gains in years to come. 2021 is the International Year of Health and Care Workers, and I think there's no better time to celebrate and recognize the work of the nursing professionals within this context. Within the campaign and the recognition of our health and care workers, the overarching words that we want to project for you is to really protect, to invest, and to work together in this regard. We want to pay tribute to all the health workforce, and indeed to all the nurses who have lost their lives or have indeed become ill as a consequence of their work in the healthcare settings. We know nurses are also at the front line in terms of the provision of vaccines and the provision of information with regard to the importance of becoming vaccinated against COVID-19. In a couple of weeks, we'll have the World Health Assembly. At the World Health Assembly, we'll be discussing the strategic directions for nursing and midwifery 2021 to 2025. And this is really based on the State of the World's Nursing Report published in 2020. And of course, the 2021 State of the World's Midwifery Report just recently published. In the terms of the Pan American Health Organization, we have been working arduously on the strategic direction for nursing in the region of the Americas, calling on really the need to increase investment in nursing education, in planning and management, and in regulation, in quality of education and training, in providing the necessary working conditions and jobs that are necessary for our nursing staff, and to build a leadership and capacity of nursing throughout the region. We remain committed here within the Pan American Health Organization to support our nurses within the broader healthcare teams, particularly at the primary care level, to improve education, nursing practice, leadership, and regulation. So I'm really pleased to open this, Sylvia. I really look forward to listening to the experiences that we're going to be hearing here this morning from Brazil, from Chile, from Colombia and beyond, around the management of the COVID-19 pandemic and the rollout of the vaccination, and of course in maintaining operations within health systems that have faced enormous challenges in recent time. I wish you all a very successful webinar this morning, and we look forward to taking the outcomes of this webinar forward and guiding the work program throughout the region. Thank you very much.
Thank you, James. Foi uma excelente entrada para decir sobre el Año Internacional de los Trabajadores y Cuidadores de la Salud, acordar a todos que em 2020 também celebramos el Año Internacional de los Profesionales de Enfermería y que ese año la Organización Mundial de la Salud ha lanzado el Estado Mundial de Partería.
And we know that we are going to be listening a little bit more about how nursing professionals have contributed to the health of citizens. So now it is a pleasure to introduce Oscar Ocho, who's going to be talking about the mobility of healthcare professionals during the pandemic. Dr. Oscar Ocho is director as well as professor at the School of Nursing at the University of the West Indies in Trinidad and Tobago. The University of the West Indies is a major hub and cooperating with the cooperating with the Pan American Health Organization in nursing. Dr. Oscar Ocho has a degree in nursing from the University of the West Indies. He also has a doctorate degree in public health with emphasis in policy formulation from the London School of Hygiene, Tropical Medicine, and he has worked in various departments in the Ministry of Health as a educator in nursing studies and responsible for health education and executive director of nursing in the Ministry of Health in Trinidad and Tobago. It is a pleasure for us to have Oscar Ocho with us.
Thank you so much. We cannot hear you, Oscar.
Right. Thank you so much, Sylvia, for your kind words of introduction. It is indeed a pleasure for me to present on the topic, Mobility of Health Professionals in the Pandemic, the Caribbean Experience. And I want to start off by reminding us of the World Health Organization statement on the international recruitment of health personnel in 2010, when they indicated that health workforce is central to sustainable health. They further state that member states should take effective measures to educate, retain, and sustain a health workforce that is appropriate for the specific conditions of each country. And they reinforce the fact that all member states should strive to meet their health personnel needs within their own human resources for health as far as possible. Now, within the context of the Caribbean, migration of healthcare workers has been and continues to be a perennial problem affecting governments in the Caribbean. In 2009, The World Bank estimated that there was approximately 21,500 nurses from the Caribbean who are working in the US, Canada, and the United Kingdom. But what is more important is this estimation done by Thompson, McConnell, and Corazzini in 2017, when they estimated that the region has lost between 15 to 20 million US dollars based on training of nursing personnel who choose to migrate. Now, when we look at the current trends within the context of migration, the trends show that within the region, we are losing our more experienced and highly specialized nurses. But migration is also facilitated not only by recruitment agencies, but by the network of family and friends who are living in the metropolitan countries. And as a result, the current trends show that there is less dependence on recruitment agencies for getting our nurses and other health professionals. Now, it is clear to us that the recurrent data show that there are push and pull factors that contribute to migration of nursing personnel. Within our context, a seminal piece of work which was done by Salman et al. Showed that low pay and poor career prospects, as well as lack of education opportunities, were the major push factors. This was also corroborated by a 2019 study done by PAHO in 26 Caribbean countries, which showed that people will choose to migrate for better working and employment conditions, better financial and economic opportunities, and for better education and training opportunities. So what are the consequences of this migration on the region? One of the realities that we face is that governments are investing in training because of their social responsibility. However, the participants choose to leave, but they are leaving with marketable skills based on the investment of their governments. But what is even more challenging is especially nurses who are doing post-basic programs, who are already qualified RNs. Some of them choose to migrate either during post-basic training or shortly after they would have graduated with their post-basic training. But there is a situation where sometimes governments institute bonding programs. However, the recruiting countries, they choose to pay the governments because it is far cheaper to pay for someone with the requisite skills than to invest in skilling them up. And what we have found within the Caribbean region, to stem the tide of mobility, the governments are becoming more dependent on nurses from Cuba and other territories, including the Philippines and Africa. But as a consequence, we are also experiencing a brain drain of our nursing personnel. And we are also recognizing that when recruitment agencies come, they are not interested in our inexperienced and recently qualified nursing personnel. Therefore, they are targeting the more qualified and experienced general and midwifery specialized nurses. But chief among the negative implications is the potential for a lowering in the standard of the quality of nursing and midwifery services, and of course, the risks associated with potentially compromised level of care provided to patients. And notwithstanding that, there is a high economic cost for recruitment of foreign nurses, and there are other social costs related to inadequate health care and loss of productivity. But when one considers the potential long-term benefits of migration within the context of the Caribbean region, what is clear is that the expected long-term benefits of migration of nurses from this diaspora, for example, we're looking at remittances for families, the knowledge and skill transfer, as well as their contributions to the diaspora, to the health sector, they have been less than what has been expected. And in fact, we can safely say that there have been no sustained benefits to the region as it relates to all the attempts of enhancing migration. And while in the past, some of the Caribbean islands instituted managed migration initiatives, they do not represent a single solution to a multi-pronged threat to healthcare systems associated with acute nursing shortages. And therefore, it requires a multidimensional approach to include retention strategies required to stem the hemorrhage of nurses and midwives from the region. Now, what are the implications as it relates to COVID-19 for the region? Well, of course, with the global border restrictions, where there is a significant reduction in both emigration and immigration, this has resulted in lower levels of migration among health personnel. We do know that when COVID just started, the Caribbean islands reached out to Cuba. But of course, with the growing restrictions, that could not have continued. We also have to contend with the high risk of infection among health personnel, and we are witnessing, not at a high level, but we are witnessing in this region, doctors and nurses, and more recently, just over the last week in Trinidad and Tobago, we have lost one young medical doctor and a senior nurse to COVID. As a result, there is less dependence on migration among countries to supplement the workforce. And what is now required is the redistribution and reskilling of staff to manage patient demands. And in this region, PAHO has supported the University of the West Indies in developing 2 short courses where we trained 83 nurses in 7 Caribbean islands on introduction to critical care, as well as a short course on vaccination in virology immunology, and communication. As a result of this, then, the regional nursing body called upon the leaders of CARICOM at their COSOD meeting to take cognizance of the fact that the region is losing its most experienced and skilled nurses and midwives through migration to more developed countries. And we also called upon the heads of governments to note the serious implications that migration of nurses and midwives have for the sustainability of effective health systems within the region, as well as efforts to advance the 2020 Agenda for Sustainable Development towards the progressive realization of universal health coverage and the integration of people-centered health services and strengthening primary health care. We wanted them to note that the COVID pandemic has exacerbated the gaps in availability and distribution of human resource for health, the ability for expansion, recruitment, and retention of personnel, in particular nurses and midwives, and migration has contributed to these shortages. And we wanted them to note the economic and social costs associated with the lack of robust retention policies. And so we asked them through our resolution to strengthen retention policies as a core managed migration strategy, to review policy options for monitoring and management of international recruitment agencies, to review and update policies that facilitate opportunities for financial and service bonds for nurses and midwives who have had their training supported by the respective governments, to develop policies and cooperation agreements that address the responsibility of recruiting countries in supporting the development of nursing personnel and strengthening national health systems. And finally, to develop and negotiate with recruiting countries financial models that facilitate the development of national health systems within the territory. And so the next steps, we at the University of the West Indies, we have collaborated with PAHO WHO to conduct a research project on the situation of mobility of nurses, midwives, and medical doctors in the Caribbean region. And what we are doing is to identify and quantify the number of nurses and midwives, as well as medical doctors who have migrated annually for the last 5 years, including the years of professional experience. We want to look at the destination countries and to also capture what are the skill sets that people are leaving with. And we also want to look at the supply countries, looking at what are the core skill sets and the post-basic experiences that they are bringing into our various countries. I thank you very much for listening to this presentation.
Muito obrigado, Oscar. Uma
Thank you so much, Oscar. What an excellent presentation. The migration topic is certainly very relevant. It is something that calls for our attention more and more after the pandemic. It's so very interesting for you to present to us the number of nurses, 21,500 nurses that are now working in the US, in Canada, and in the UK, and what cost that represents to the different countries. You've also told us about the need to go on investigating what is the impact of the migration of nurses on the health system and on the population as well. We tend to focus this phenomenon in the Caribbean, but we do know that this is also going on in other countries, including in other Latin American countries. And this migration occurs both from rural areas towards urban areas, as you've mentioned, but also amongst the different countries at an international level. You've also emphasized that this migration occurs because the professionals search for better work conditions or pays and education. And literature has also been telling us about the post-migration experiences where many nurses end up experiencing problems such as discrimination, racism, including having to occupy jobs that are underneath their competences and skills. So we need to establish retention and cooperation policies. In other words, there is a need for further investigation and research in the different countries on the migration of nurses. Let us now go ahead and hear the other panelists on a very interesting topic, which is the role of health professionals during COVID-19 and especially during COVID-19 vaccinations. We are going to hear the experience of three different countries, Brazil, Colombia, and Chile. How are these countries developing their vaccination campaigns? And how are these countries preparing themselves and carrying out their vaccination campaigns? So I'm very pleased to begin with Professor Ethel Maciel, Associate Professor of the Nursing School of the Federal University of Espírito Santo, Brazil. She is a nurse licensed by this same school, the Federal University Espírito Santo. She has a master's degree on collective health from the state Rio de Janeiro University and a PhD in epidemiology from the a university in the US. She is the president of the Brazilian Network on Tuberculosis Investigation and member of the study group on this topic at the health ministry level. And she has lots of other involvement actions in different fora in the same area. So I'd like to give you the floor, Professor Ethel Maciel.
Thank you very much. I would like to already take this opportunity to thank the organization for this invitation to allow us to talk about the experience in Brazil. So much could be said, but I will focus specifically on the nursing profession during such a difficult time for all of us. So good morning to all of you who are here with us today. So what kind of nursing are we talking about in Brazil? I will talk about the immunization campaign and some lessons learned that we can use going forward. First of all, who are our nursing professionals in Brazil? 23% of the entire nursing team in Brazil is made up of registered nurses, and 77% are assistants. They are nurse practitioners. They don't have a college degree. That is how things take place in Brazil. It's a little bit different in other countries, but that is the situation in Brazil. 85% are women, 60% are under 40 years of age. It's a very young group, and 53% declare themselves to be Black or brown. Those are the terms that they use, and most of them, that's how they call themselves. That was a survey carried out by the Nursing Teen Profile Project from 2017. And I also wanted to highlight that this group of professionals generally come from families in which very few have college degrees. So most registered nurses and nurse practitioners have very limited family history of people who have gone to college. Only 8% had a mother who has gone to college, and 13% had a father who has been to college. And during the pandemic, what we found out is that the nursing profession in Brazil is quite invisible in the sense that salaries are very low. They are not valued as other health professionals. But during the pandemic, people's perceptions of these professionals changed dramatically. There were different campaigns in the media throughout the world as well. This is the first person in Brazil to be vaccinated. And I would say this was a symbolic picture taken January 17th, 2021. This was a nurse who had taken part of clinical trials. She had been in a placebo group. So a Black woman nurse who represents the entire cohort very well. And this little boy playing with this nurse heroine was also very touching. And you see the other poster, Thank You Nurses, where it's also depicted as a heroine. In general, Brazilian nurses face very bad working conditions to feel like heroines, but I will later talk about how things have started to change. After many hard attempts to regulate the profession in 2000, now it's finally a regulated profession. In 2020, many shelved bills. This bill 2564 proposed by a senator from Espírito Santo proposed this bill, which included the two main requests by the professional class, which was to regulate the working day, the hours and the rights, as well as a base salary. Just to give you an idea, an assistant nurse makes around $200 per month, and a nurse makes around $400 per month. And so those are the professionals we are talking about, and those were the people who worked tirelessly during the pandemic. So from the very beginning of the pandemic, we had 776 people, both nurses and assistants, who died victims of COVID-19 in Brazil because of the work they did. So they were very exposed. As we know, and Brazil ranks very high as a country in which nurses have had a very high number of deaths during COVID. So the Brazilian strategy in order to fight COVID was basically, the strategy basically focused on increasing the number of hospital beds. Each state started to develop their own controls separately, but the main indicator was to set up makeshift hospitals and ICU beds and regular hospital beds the focus was primarily on infrastructure in that sense, and not very focused on primary health care. It is very limited. Our family health program in Brazil is basically the only access to health many communities have. However, that strategy remained very limited to those communities, and the overall strategy for COVID focused mainly on those numbers of hospital beds. However, the primary care attention, especially focusing as nursing professionals normally do so well, had COVID actions focused on family care, family visits. I believe we could have lessened the impact of the pandemic greatly, but that was not done. Very early on the pandemic, we started talking about how nursing could play a much more central role in surveillance in healthcare, especially focusing on primary care health. We developed this entire flowchart on how to identify a new case, what could be done, how it could be implemented in Brazil. But unfortunately, the rollout was not very successful. In fact, primary health care was reduced. The number of appointments were cut back, and all of those community-based healthcare centers focused only on COVID, and very few outreach activities were carried out to be in touch with the community and promote learning in order to limit the pandemic spread. There was no active search of cases, testing. None of that took place in Brazil. So once our vaccination campaign started out, it's important to know that we do have what we call our PNI, or National Immunization Program. It was created in the 70s. It's highly successful, and it is one of the largest immunization programs in the world. We offer free vaccines, over 20 of them, so it's truly a success story. And throughout these 38,000 vaccination rooms we have throughout Brazil, nurses are the professionals ahead of those 38,000 facilities. So clearly, this is a professional of paramount importance to health in Brazil. We could have led in education campaigns, especially talking about vaccine reluctance. That's something that we saw in Brazil, and we noticed it was also happening in the US. We even saw some policies and authorities that were promoting that reluctance. And at the same time, we should have used all of that connection that happens, that had been built with communities, between the nursing profession and communities in Brazil, to take advantage of that connection at this moment during a pandemic. But unfortunately, our communication was not effective, and the entire class of professionals was under great stress. We had some isolated issues with giving the vaccine itself. Some very few professionals, nurses, did not apply the vaccine correctly. They made mistakes. And unfortunately, that got a lot of attention and jeopardized the overall image that people had of the profession. And people became very suspicious and felt like nurses were not properly trained for their job. And so those occurrences, which were very isolated and few and far between, ended up having a very negative impact on people's willingness to take the vaccine and their trust in nurses' abilities to give that vaccine properly. Unfortunately, because of those very few mistakes, that was a very negative consequence of those mistakes. Now, the lessons learned that I wanted to mention, one of them would have been the need to create campaigns to inform, to disseminate details on how these professionals actually work so that the profession can gain more visibility, so we can inform people of what these professionals need, what we do, the level of importance, the role those professionals play in healthcare and in everyone's lives, so that we can stimulate the new and future generations to investigate that possibility, to invest in training for the profession as well. Nurses throughout the entire planet are involved in these actions right now, and we do need to promote capacity building among nurses so we can better understand what to do, what has to be done, so that we can promote and invest in the profession as a whole in Brazil increasingly more. These campaigns need to highlight their value and put it in the news, put it on front pages, and have it on headlines so that we can correctly value their work. But we are missing on that opportunity, the timing, the right timing to do that. So in marketing campaigns, in the news, we don't see people, our associations, they should advocate for the profession, take advantage of this moment, as opposed to those individuals who occasionally make a mistake and end up getting all of the attention. We do need to communicate the right message to society. Here is my email address. Thank you once again. I want to use this image as a symbol. We are not superheroes or heroines, but we are people who, despite our fears, our challenges, we do offer courage, our lives to society and to the planet. Thank you so much, Dr. Ethel. This was an excellent presentation. It is very interesting when you first correlated nurses to family members. And we know very well that as women, we have advanced greatly in terms of social and economic mobility. And you also highlighted the stress we go through, burnout, and even violent attacks that nurses have suffered in many countries during the pandemic, and the lack of trust sometimes populations feel toward us, not only during the vaccination campaign, but also as a possible vector of the infection of the pandemic. And you also highlighted very well how we need to invest in valuing this profession so that future generations may pursue it. That was an excellent presentation. Now, I would like to invite our next speaker. We really want to know how vaccination is going in Chile. So I'd like to invite Ana Maria San Martin Venegas. She's a director of the nursing division in the Ministry of Health in Chile. She studied nursing at the University of Chile, and she has a master's in public health. She has countless credentials, and she's currently director of nursing within the Ministry of Health, and she was appointed in 2019. It is a great pleasure for us to have this guest here today and listen to Ana Maria. Chile was a country in which no nurses were officially part of the Ministry of Health, but in the current administration, now there is a nurse, an official Ministry of Health nurse. And for the first time, this very new position is being filled by Ana Maria San Martin. I'd like to congratulate Chile on that initiative. Ana Maria, you have the floor.
Muchas gracias y bueno, buenos días y saludos a todos mis queridos
Thank you
colegas.
very much. Good morning. Greetings to all my colleagues. I'm proud to be here with all of you today. I don't know if you're seeing my presentation. Can you see my presentation? Yes, we are
Yes, we
seeing and
see it and
hearing
hear you
you
well.
very well. Well, thank you. Chile has been characterized for having been for a very long time a country able to have a strong public health system with great planning. That's why the nursing profession has an important role in all the activities in our sector, going from management or directorate of some programs all the way to primary care, where nursing colleagues work with the population, the families, and the communities. When one thinks, am I in the presentation or not? Yes, you are in the presentation, and you can move to the next slides, or you can proceed with your presentation. This timeline is very important because it shows that the success and the implementation of this vaccine, which has been very successful and quick, is based on a historical background. Suffice it to think that in 1805, the first vaccination board was created in Chile. In 1950, vaccinations were implemented on a mandatory basis. In 1950, smallpox was eradicated. In 1952, there was a consolidation of the health system with a centralization of health policies. With decentralized activity through the health system network. In 1954, we started vaccinating against diphtheria and poliomyelitis and whooping cough. In 1963, anti-measles vaccination. 1979, we included the vaccination calendar with the immunopreventable series. In 1990, we started measles, rubella, and parotiditis vaccine. In 1996, we incorporated the hemophilia influenza B vaccine. And this is just in the calendar, the mandatory vaccination calendar. In 2014, we incorporated the VPH vaccine, and in 2020, against smallpox, varicella, and also the basis of the right to health in our country. This is included in our political constitution, so ensuring to everybody the right to health protection is a fundamental right, and that includes also vaccination. The state guarantees to all people the free and equal access to health promotion, protection, recovery, and rehabilitation recovery actions. And this, wherever these activities are implemented, it can be in a public area, in the armed forces, in the private sector, etc. But it's the ministry the one that issues guidelines and monitors these implementations. And when it comes to the national immunization program policy, we also have been active for many years. This program has been implemented for many years by nurses, especially by one nurse who had advisory councils at the medical and nursing level. And she issued all the policies and disseminated this with trainings, with monitoring and assessment, with successful campaigns, and the elimination of some of some of the transmissible diseases. So the national immunization policy program is a right for the entire population and is guaranteed by the state. Vaccines are mandatory for the entire population in the country. They are free of charge. And the vaccines have to be authorized by the regulatory authority, which is the Public Health Institute in Chile. And epidemiological surveillance this surveillance, as determined by our founder, Florence Nightingale, is conducted by nurses, and the incorporation of new vaccines is guaranteed by government budgetary support on a permanent basis. The mission of the immunization department is to the protection of the population living in Chile vis-a-vis immunopreventable diseases of pertinence for quality public health. And here we show the very important role of nurses inside the immunization program. Nurses have to learn about the epidemiological situation of transmissible diseases in the country, especially those that are preventable. And they have to develop an action plan for protection vis-a-vis these diseases to maintain inputs and the distribution through cold chambers all over the country, to participate in the strategic communication for vaccination in the framework of campaigns, and it includes the standardization of processes and procedures on the conservation of vaccines, administration techniques, target population, and vaccine registries. They train other nurses, they ensure the cold chain, they monitor and assess result and impact indicators, among many other actions that nursing professionals have. This is a vaccination calendar in 2021, free of charge, of a large scope, and it is mandatory. Yellow fever vaccination is only administered on Easter Island because in continental Chile, that's not a health problem. What happened with the nursing profession in the framework of the world pandemic? The first thing we have to see is that the pandemic was faced or addressed with a very proactive strategy and focus. And we did an early purchase of respirators and preparing hospitals where nurses reconverted beds. They trained human resources and they provided all the inputs of protection, and they instructed their colleagues about the use of PPE. So nurses have had a very significant role in this pandemic, and in the area of public health, with all that implies, they had to leave their families, their children. They had to go to live in health facilities to face the pandemic. And all this entails a very high personal cost and all. In the public health area, we have deployed actions and we implemented many strategies to reach the target population and meet our goals. But for this, we need to have early negotiations from the Chilean government for the purchase of these vaccines, by executing contracts with vaccine manufacturers to have enough doses from 2021 to 2023 to vaccine the entire Chilean population. These purchases were conducted in mid-2020. When we talk about the Chilean population, as many other countries, we have a large migratory population that is arriving to a country. And as any other individuals arriving in the country, migrants are also immunized. The World Bank stressed, and this Chilean campaign of immunization, saying that it was a team that had conducted a proactive, strong, and coordinated activities. I'm proud about this statement by the World Bank. So it is easier to reach the entire population with educational messages and through the social networks. How did we prepare? Before the arrival of vaccines, we developed a plan for COVID-19 vaccination. We conducted multiple meetings with the Seremi, health services, hospital networks, and public-private health network activities. And also there was the support of technical documents with vaccination guidelines and planning, and campaigns of micro-planning in operational sites. Also educational, preventive education documents and research, vaccination for pregnant women and also for immunocompromised patients, which include patients living with HIV. These technical and operational guidelines for this vaccination were provided under a general framework within the campaign including information system, cold chains, social communication, training, supervision, monitoring, stock control, monitoring and coverage assessment, and the organization of our campaigns. Here we see our authorities receiving these vaccine shipments in their depots. The National Immunization Program organization is housed at the Health Ministry, which issues the policies and technical guidelines. We also have the Public Health Institute, which is the one that authorizes the registration of medicines and vaccines that arrive in Chile. We have a supply central with large cold chambers to store the vaccines, but also that was the central level. But at the intermediate level, Ceremis is an institution that also manages cold chambers, and at the local level, we have vaccination facilities, outpatient facilities, primary offices, and rural stations. And the operation organization for COVID-19 vaccination led us to open different facilities at the 16 regions in Chile. Vaccination facilities in primary care, in specialties, private clinics, stadiums, and other facilities. As I said, in the entire country, the 16 regions, to have the widest possible scope, reaching as much, the largest number possible of the population. These cold chambers are in, we have cold chambers from the north to the south of our country. We have different cold chambers to store vaccines. Nursing everywhere, from the regulatory to the operational part. Nurses participate at all stages of our campaigns, and the nursing profession also carries the vaccine to conduct their work. In this vaccination process, the ministry developed on a gradual and progressive process. During the first quarter of the year, we were hoping to vaccinate around 5 million people and reach 80% of the population. That is to say, 15 million people approximately vaccinated by the end of the first semester of 2021. As I said, getting vaccinated against COVID-19 is on a voluntary basis, and it's free of charge. And we also have our priority groups for vaccination. Of course, the health staff, especially the critical care units, people with comorbidities, people living in long-term care centers, including the elderly, and also people with disabilities, physical or mental disabilities, people of more than 65 years of age, education staff, and critical staff of the government. And we also created a webpage of the ministry that makes it possible to inform the population, indicating where the vaccination facilities are located at each community. And we also indicate what vaccines are registered and the vaccination process. mevacuno.cl with technical information, news, information for pregnant women.
So we have this weekly publication, and this covers who they are, who are the people that are going to be receiving the vaccines, what age groups, and that's all part of our strategic
Temos também
communication campaign.
registro de
We also have a
imunizações
national registry
que
of
vai dando
immunizations
informações e montando
as
os
we continue to move
gráficos em
forward with
relação
our vaccine
ao
campaign.
desenrolar da vacinação.
And
E temos
people
também o código. A pessoa pode, através desse
we have, for
código,
example, how you
imediatamente saber qual é a
register and
situação.
you get your vaccine card.
Enfim, são
All of this
processos
process has now been incorporated
incorporando
by the health
autoridades
authorities with
profissionais da
nursing
saúde e também
personnel as
outros
well as support
profissionais de
and
apoio e
administrative personnel are
administrativos,
working
todos
together,
eles
and the
colaborando.
president
E o
is
presidente da
informing the
República, que
public
participa
every
das
day
informações à
about
população diariamente,
the
fala-se do
number
número
of
de
people that
pessoas,
are receiving
o número de
the
leitos
vaccines, the
disponíveis,
number of
os
cold storage
exames,
unit
número de
available, and
vacinados. E
also
muitas vezes
we also
também
offer
deixa-se o espaço
opportunities for those
para
people
que
who are
as pessoas
living
possam se
remotely can get
vacinar,
an opportunity to get a
aquelas
vaccine
que
as
estão
well.
em atraso. Aqui
So
algumas
we see
imagens
here the
do
role of
trabalho
the
das
nurses at
enfermeiras
every
em
level,
todo o processo de
both
vacinação.
outpatient as well as
Esta
other
vacinação, temos aqui
vaccine
gráfico
scenarios.
de
So here we
23 de
have
abril de
the
2021.
trend,
Temos aqui o
and we can see the
número
number
de
of vaccines.
vacinas
Actually, Chile right now is number
administradas.
3 in the
Nós estamos
number
no
of
terceiro
vaccines behind
lugar aqui,
Israel and the UK.
mas
But now
em
looking at
relação
share the
à
population
taxa de
fully vaccinated,
pacientes, o
Chile
Chile
is number
ocupa o segundo
2
lugar,
after
sendo o
Israel.
primeiro
We're
Israel.
seeing here
Aí estão os
up through
números dos avanços da
May.
vacinação.
This is a breakdown
Aqui
of the population that
para
has
Maia,
received
44.
the vaccine.
E aqui
We can
podemos
also see
ver
it by
pelo
age
grupo
groups with the first
etário em
dose.
relação à primeira dose.
And
87,37%
we see, for
para
example, that
aqueles acima
86%
de
of the
65,
population over the age of
depois de
65 have
60 a
received it, at
64
least the first
anos,
dose. From 60 to 64,
87%,
87%.
50 a
From 50 to
59
59,
anos,
81%. From 40 to 49,
depois 40 a
63.7%.
49
And from 18 to
anos e
39,
18 a
about
39
18% or
anos.
20%. So
No que se refere
here
à
we also
segunda
have
dose, também para os
those that
mais
have already gotten
idosos,
the
temos mais
2
ou menos o mesmo
doses.
número,
84% over the age of
84,4%,
65,
depois 82,
82% of those
97,
60 to
depois
64,
os
50,
grupos
59,
de 50
70%.
a 59 anos, 70,
From 40 to 49 years of
58%,
age,
40 a 49 anos,
34.5% of those have received vaccines, and
54,57%.
now
E
the
este
18 to
grupo
39-year-olds,
último aqui,
24%.
na
So there
verdade,
are
muita gente,
many
devido à questão da Covid e da
people
segunda
who
onda, muita
are
gente
living
tem
in
medo
remote
de
areas
comparecer
are
aos postos de vacinação,
afraid
com
of going
medo
to these
de
locations because they're
infecção.
afraid
Aí
of
está,
becoming
portanto,
infected.
a
So that's the current
realidade
reality
do Chile
in Chile
e, de
regarding the
fato,
COVID
o
vaccines.
trabalho da
The
enfermagem,
the
tanto junto ao
personnel working
paciente
in
crítico nos
hospitals
hospitais,
and in
quanto
these
o trabalho
critical
da
care units,
vacinação,
we have
é
seen
uma grande
real
demonstração
devotion to
da
moving
ação dos
forward. So
nossos
we should be
profissionais.
celebrating
Então, nós
as
devemos
we
estar
commemorate Florence
comemorando,
Nightingale,
mesmo
and
além da comemoração
also
do Dia
when we see what's
Internacional.
been
O
going
que é
on with the
importante
pandemic,
é ver o que
this
aconteceu nessa
this
pandemia. A
the
população
population, this
nos
community knows
reconheceu.
who the nurses
A
are,
população
and
sabe
this
quem
is
está
very
trabalhando nessa
valuable
pandemia.
despite
E
the
isso é
tragedy of the
muito
pandemic.
valioso,
So thank you
principalmente no
very much.
contexto da tragédia
And
da pandemia. De forma
for
que,
any
muito obrigada
questions, I'm
pela
more than
atenção.
happy to
Estou à disposição
answer
para
you. So
respondermos
thank you,
suas
Ana Maria.
perguntas. Muito obrigada, Ana Maria San Martín, por essa apresentação excelente.
La vacunación en Chile y ahora con tu exposición hemos
Thank you very
visto
much. And we've heard very clearly how the situation is unfolded and how Chile has successfully achieved a 44% coverage of the population with at least one dose. So congratulations for your work. And of course, in the we want to congratulate the Ministry of Health in this very important effort that you are involved with. Thank you. So now let's move on. I would now invite Gloria Lucia Arango, who is associate professor at the School of Nursing at the Colombian National University. She has a master's degree in health administration from the Javeriana University. She has a doctorate degree from biotechnology, and she has several publications on the ethics in organizations, as well as in the nursing profession, also patient safety measures, and also in the area of research. So Gloria, if you could please share your screen, and I would just
hay que salir para que
I
Gloria
ask Ana Maria to please maybe remove remove her presentation.
¿Ya me ven aquí la pantalla?
Sí, sí,
So go
muy
ahead.
bien.
Yes, thank you.
Buenos días para
Well,
todos.
good morning, ladies and gentlemen.
Muchas gracias por esta invitación.
Thank you very much for this
Yo
kind
con estos 10
invitation.
minutos que son
And
asignados para presentar, solo quiero hacer un homenaje
I just, first of
a
all,
las
would
enfermeras
like to
colombianas
pay
y a las
tribute
enfermeras
to
de
the
Estados Unidos y del
Colombian
mundo
nurses
por un
and
trabajo
also
que
nurses around the world
son
for such a
inconformables.
valuable
Simplemente quiero
effort that
presentarles
you
a
make,
ustedes
such a
unos
courageous
roles
effort
que han
that
sido
you
muy
make. And I just want to
difíciles
discuss
en
some
el
of the
caso de Colombia,
roles that have been highly
como en
challenging
el proceso
in
de
Colombia,
vacunación contra el
especially with regards
COVID-19,
to the
unas
vaccinations,
estrategias
the
que
COVID-19
sin lugar a
vaccines,
dudas
a
significan
strategy which, without any
una
doubt,
enorme capacidad logística,
constitutes,
generar
requires an enormous
suficientes
logistical capacity
recursos
and
humanos,
resources,
capacidad
as well as
enorme de la enfermera
a huge effort
para
by the
trabajar
nursing
no solamente
profession,
para
working with
trabajar con
the
sus colegas,
community, working with the
para
colleagues,
prestar
and
para
to move forward. Yes, Gloria, could you please
¿Toda? Ok.
could you just expand your screen, please? Thank you. Much better, much better.
Entonces, lo primero que tendríamos que decir es que esta pandemia
So the first thing we need to say is that the pandemic brought together
todos los actores de la sociedad,
all of the stakeholders
todos los
in
actores de la
society,
sociedad en un ejercicio
all of the stakeholders in creating this spirit of solidarity and support
la cual,
that
al cual nos sumamos los enfermeros.
we in the nursing profession fully join. So with the national COVID-19 vaccine plan, national plan, we include the, of course, nursing profession, but we also, in this effort, which we hoped would be intersectoral, we worked not just with the ministry, but also with other sectors so that we could develop and formulate and design this vaccine plan. And we, as I said earlier, we included all of the social stakeholders that could provide the necessary support. So the universities, not just the nursing schools, but also other healthcare training and universities, centers. Also systems engineers also played a key role in terms of the huge information resources that would be required. We also had the nursing program coordinator joined in this national and regional effort. But I should also point out that in Colombia, we know that the vaccine programs have always been a traditional area of responsibility for the nursing profession. So many professionals worked with us, not just in developing the national strategy plan, the design of the vaccine program, but they were involved at every step of the way. So let me just point out and highlight how the nursing groups have provided very interesting support in terms of not just formulating, but also implementing the plan. So as I mentioned earlier, we had the nursing schools, we had universities involved, and as was already indicated, we had consultancy firms as well. We had professional associations, not just the nursing professional associations, but we also had the personnel from nursing schools, the administrators, coordinators, and nursing staff from all of the hospitals, clinics, healthcare centers, even nurses from schools. The school nurses were providing information and distributing data to the families, the households. In other words, raising awareness among these households. And as was indicated earlier, we had nursing staff from national oversight and national medical authorities. So the role of providing consultancy and advisory services was essential because at the individual level, at the group level, universities, professional associations, in nursing groups, again, were a part of formulating the proposals and recommendations for the vaccine plan. We also had the support of nurses from the, for example, insurance agencies, insurance companies, also provided their inputs and feedback from surveys that were distributed. So they provided their own perspectives, their own inputs to make sure that we had a robust and well-founded vaccine program. Now, the educational role has also been indispensable, very important. I just want to once again indicate that we had nursing schools and universities from throughout the country that made the effort to find alternative awareness raising programs, working with healthcare professionals and faculty from medical schools and nursing schools to raise awareness about the vaccine program. Various courses were already developed regarding the characteristics of the vaccines and how they are administered at various levels to make sure that the language was clear, the instructions were clear, so that all of these actors committed to the effort could know with precision all of the information to better understand it. And there were also efforts undertaken by universities and academic institutions to raise awareness again with the community. And you had, for example, the National Health Education Center, where there you have nursing assistants who are trained, and all of this, the sum total of educational efforts have recognized the role of nurses in education, not just for the families, healthcare users and the families of these users, but also professionals and health assistants, so that these the results really have been a win-win situation in terms of making them their role of nurses more visible. There's no doubt that this exercise in terms of local and regional, national vaccine campaign programming has required the full effort by all stakeholders. But also, just to mention that within the institutions themselves, we look at in the most remote areas, we're providing these alternatives, nurses who are verifying and ensuring that people can reach healthcare centers to receive vaccines either by boat, even by by horse, and any way they can move from these remote areas to get their vaccines. So this has been again tasked to professional nurses. So this oversight has been without any doubt an exercise that has required a Herculean effort in coordinating, in formulating, and logistics. And it's been, I believe, very unique of the nursing profession, and other professionals are now very aware of this, and that's why we admire so much the organizational capacity as managers, playing the role of managing the distribution of vaccines to the most remote corners of the country. They've also served as communicators, and you can see this, how this has played out so positively, where the nurses from professional associations, from hospitals, from healthcare clinics and facilities, etc., have all served as communicators to inform the public, spreading the word in the communities through the radio, through local radio spots where nursing staff has informed the community. I would also like to point out a role that reflects I think it's one of the greatest attributes of the nursing profession, and that is how they have called those that are going to receive the vaccines. They have faced situations where nurses have intervened, explaining to the users, even when they were already in the vaccine areas, that they've had to sometimes tell people that there weren't enough vaccines, and also we know that the nursing staff, and I know this from some of my colleagues who have talked about how difficult it is to tell people that they've run out of vaccines and have to address the conflicts that may ensue from that. So I hope I haven't exceeded my 10-minute time limit, but I just want to also mention that what we need, well, first of all, what have we contributed to the profession? Well, I think we have made huge gains for the country. This has generated greater awareness about the group, about the work and cooperation among nursing staff and other groups, but also there's greater recognition now of our value to the public health sector. And we've had greater visibility, relevance, and this, as a result, has made the profession more aware by the public, more visible, and its contributions to the country have now become much more aware by the public. So I'm very pleased to be here to commemorate the International Day of Nurses. And again, thank you very much. It's a pleasure and an honor to be here. Thank you. Thank you very much, Gloria. Excellent. As you showed the role of nurses in Colombia, a role that faces many challenges, a role that all of us, we know about the difficulties and how the profession has brought so many positives, as you've stated, during this crisis. So now we'll move on to the last part of our event, and we're going to show you, well, Gloria, if you can just remove your presentation. If you could just stop sharing your screen, that would be great. Thank you. And we're going to introduce various initiatives that we are going to launch as we celebrate International Nurses Day. I would invite all of you to visit the PAHO website. This is a website where you can see in the presentation where we have, in addition to this event, where we have almost 800 participants, and thank you all for being here. And this is where you in the future will see these recordings. So the first thing I would like to introduce now, this is basically a current status of nursing in the Americas. It's a short slide presentation, but it has a lot of information, and I'm sure that you'll be able to use these brochures. You can use them in your universities, in your healthcare centers. So the first part of this brochure shows exactly what the current status of nursing is in the Americas and in the world, where we have 27.9 million nursing professionals in the Americas. And that means we actually represent 56% of all of the healthcare professions. And therefore, it's the most numerous profession in the health industry that we have. The second part of this presentation or slide, or who have the 8 million that represent 30% of the total in the world. 87% of these professionals are in 3 countries in the Americas, the 3 major countries, Brazil, Canada, and the United States. So this is something that we always find very surprising to hear, because 87% of all of the professionals, healthcare professionals, are in 3 countries in the Americas, and that about 89% of our profession is made up of women. So this is a call to all of us. We need to make this profession more attractive for men as well, since out of every 10 women, we only have 1 man representing that profession, 1 for every 9 or women. So here we can see the density or per capita number of nursing professionals per population, starting with the United States, followed by Chile, Canada, Cuba, Brazil, and Uruguay. And we can see, therefore, the per capita number of nursing staff in each country. We know that some countries have a long way to go to expand the number of nursing staff, including Haiti and Honduras. And we can see these disparities between the distribution of professionals per 10,000 inhabitants. As we move forward with this presentation, we can also see the education profile of the nursing staff, as well as technical and auxiliary staff. And then we'd go down to the main opportunities and challenges faced by the countries in the region in trying to strengthen the nursing profession and within the healthcare system. So we have a description, and if we scroll down a little bit more, Bruna, you can go down a little bit. And here we have a description, some of the opportunities and challenges in order to strengthen the nursing profession within the healthcare systems. And then we finish up with looking at the investments. We in fact, the message is investing in the nursing profession will help to protect the healthcare and the lives of our citizens. You can use this, you can download it, you can use it in your presentations for your students, as well as nursing and professional staff, as well as other professional staff that would like to learn more about the current situation relating to the nursing profession in the Americas. In addition to that information, we also have a second deliverable that we're coming up with. This is it's a booklet that's currently only in Spanish, but we're hoping over the next few weeks that we can also have it translated into Portuguese and into English. So the title of the booklet is the contributions of nursing and midwifery professionals to women's health. And you can see it's down here at this website, irispajo.org. You can download the information. So please do that and disseminate this to other stakeholders those perhaps who were not able to attend this webinar so that they become familiarized with the current reality in the healthcare professional community, those who address the healthcare needs of women. And we can see in the next slides some of the key narratives. The book is divided into several chapters. The first part addresses the initiatives, the health professional initiatives at the three basic levels of healthcare. We have examples from Guyana, from Canada, Bolivia, Panama, Uruguay. So there's several countries that are providing their experiences and the initiatives relating to their professionals. So I invite you to look this over. Then the next part of the book, part 2, addresses specifically some narratives, some stories of professionals that have worked in remote communities as well as vulnerable communities. Just to give you an example, we have the story of Guatemala and Mexico that discusses an initiative addressing women facing domestic violence. And then part 3, which is subdivided. First part looks at educational initiatives for healthcare professionals. And here we have a lot of narratives covering the pandemic. Also, we also have Chile's experience with tele-midwifery and another interesting experience that includes cooperation of efforts between a healthcare facility and universities in order to support midwifery services as well as education in healthcare, as again dealing with maternal health. And then part 2, the sub chapter of part 3, also it talks about some of the experiences of healthcare service users, some interesting stories about using, for example, the prophylactic remedies in midwifery. So these are stories that I believe these experiences in primary healthcare can be enlightening for many countries. A lot of more stories needed to be shared. So they're interesting initiatives headed by nursing staff, developed by nursing staff that need to be shared.
And the third product that we are launching today is the celebration of the 2021 International Day. It's a video that was developed by the University of Illinois, the nursing school, our collaborating center in the area of nursing for PAHO WHO. This video is translated into 3 languages and it is available on YouTube. It's a short video. We will show it for your benefit now.
Muchas gracias. Espero que ustedes tenham
Thank you
se
very much. I hope you have been delighted by this video, as I have been delighted once again. My sincere thanks to our collaborating center at the University of Illinois Nursing School. We thank you for your support to PAHO in this project, showing this video to all the nursing professionals in the region. Before handing the floor to Dr. Fernando Meneses to close the session, I want to thank the almost 800 participants that have been with us today. Congratulate everybody on tomorrow's celebration of the Nursing Day. And before concluding, I want to send special greetings to nurses from Uruguay who will initiate in a few hours the Political Health Dialogue in Nursing Uruguay 2021, which will certainly be disseminated in the next event as to the situation of the policy dialogue on nursing in Uruguay. Thank you very much. Now I hand the microphone to Dr. Fernando Meneses. Thank you very much, Sylvia. Can you hear me well?
Sí, te escuchamos bien.
Yes, we hear you well. I'll start in English.
I'd like to salute the participants of this webinar. I want to begin by thanking Dr. Silvia Cassiani for hosting and moderating this event today. A very special thanks to our speakers and commentators. I'm very, very impressed by the quality of the video that was presented, and that just falls inside of the collaboration that we are having from our collaborative centers. This is very important for our activity. I would like to congratulate all nurses in our region for this very special day, but mainly for being with us all the time. All the time, the nurses are with us without any doubt. They are in the forefront of the health systems. It's also never too much to thank all health professionals on this webinar today for your hard work and commitment during this time of pandemic. I quite understand the comments made by Professor Aitel from Brazil, nurses being called heroes without having valuing the work. However, you have risked your health to save patients. Your countries definitely are in debt to you. Therefore, I want to pay tribute to the nurses and those who lost their lives in the pandemic and other health situations. As you know, being the forefront is a very risky activity. I'm pleased to have the opportunity, Sylvia, to share a brief thought on what was presented today, the lessons that we learned today in reference to the pandemic. First, it's essential to highlight the impressive achievements and ideas brought about the nursing profession. As you can recall, we just have a very interesting discussion talking about expanding the roles of the nurses, the practice of nurses. And that was very important. And also I would like to congratulate Professor Oscar Ocho for looking at the very complex issue, that the issue of migration or the issue of mobility, because we have to look at a kind of multi-factor approach to try to solve this problem. But that's very important. And also this another example of how a collaborative center can work together with WHO and PAHO in order to sort the problems that we have in our region. Me gustaría ahora cambiar un poco para español.
Now I would like to switch to Spanish. What was presented here by our colleagues is very important. Our colleagues from Chile, Colombia, because this reminds me that, first of all, it's always very important to work considering nursing as the pillar of our health system. If we don't talk about the nursing profession all the time, not just now. Now there's a strong recognition about the capacity and the need for nurses, but we are also trying to work with all of them, and not just to put the nursing profession at the core of our system, but it's also important to value. Valuing the profession is very important because all the time, and I refer once again to the comments of colleagues, that we should all try to solve this issue because the work of nurses is not very highly valued. And this is reflected in the working conditions and the low salaries. And this also points to the work of Dr. Prof. Oscar Rocha. This is one of the reasons why many nurses tend to leave their countries, moving to other countries in search of better working conditions. So at this point, it is very important to stress that when it comes to health workers, and it is very important to value in the right measure, to rightly value the dedicated work of nurses. And this type of work is very well coordinated at a regional level by Dr. Silvia Cassiani, but it involves not just the health sector, it involves other areas. It's a cross-cutting work. We have to coordinate together with the educational and finance sectors, and also the sector that works in the regulation of health professionals. It's very important to talk about regulations because the health professional regulations are what make it possible to use in a better way the capacity of nurses to contribute to systems. So the expansion of the roles of nurses within systems is a very important work that is stressed at our unit, which has planned several activities for this year. This is just one of those activities, very important, but it's just one. And so I invite all of you to continue accessing the PAHO sites to see how we will continue working on the issue of nursing and other human resources related topics over the years.
And finally,
And
a few words in Portuguese. I would basically like to invite you, because we are currently undergoing a joint project with nursing schools, with governments, with public sector nurses, generally speaking, with many countries, going towards what we decided was important. We decided to call this year the Year of the Healthcare Worker. And the activities we are developing basically follow a guideline established by the Human Resources Strategy approved by countries in 2017. And it also follows an action plan, which was approved and has three very clear lines of action. One focusing on public policies, governance, another working conditions and work management, and the third one, capacity building and training. So it is very important to focus all of our efforts in these areas, recognizing the importance of nursing, but going beyond that recognition and also promoting greater investments. This is the time to secure that increased investment. And I would like to also take note of the pride Professor Gloria showed when she said, "I'm proud to be a nurse." And that's needed because we are proud of nursing. Within the Pan American Health Organization, nursing is indeed one of the highest points, not only right now, but always. It is greatly valued. So thank you once again, Sylvia, for this opportunity to be a part of this event, to have heard you, to have heard Chile and about their immunization program. Generally speaking, to see how all activities are being carried out, and also to see that we are headed towards a very positive stage. Thank you all once again. Under your leadership, Sylvia, we are at a great moment. It's a very happy moment for me. But however, I have to bid you farewell because this is probably going to be my last international year in this position. I will be retiring this year and will return to my activities at the university where I work in Brazil. So thank you, Sylvia, for this opportunity. Thank you, colleagues. I wish you all a wonderful day. And I hope that everything that we heard today, how all the rich presentations we heard today will help us to advance the nursing profession in our region. Thank you so much, Dr. Fernando Menezes, and thank you for your support through all of these years. Much of our gains and progress were due to your leadership and your guidance. This was a great opportunity for learning, and we wish you success in your future endeavors as you return to Brazil. Thank you all for being here with us today, for having been with us this morning. Please visit our website and take advantage of all of the publications that are offered to you. The meeting is adjourned.